Astrological insights on a potential virus crisis. Spread, impact, and control. Astrology offers a unique perspective on global events, including health crises. By analyzing planetary placements in the provided D1 and D9 charts, we can explore the potential emergence of a virus-related crisis, its spread, and its containment timeline. Key astrological indicators of epidemics. Rahu and Ketu 1. Represent chaos, unseen forces, and disruptive changes. 2. Their placement in critical signs or houses often signals health crises. 2. In Virgo and Pisces, they indicate issues related to immunity, hidden diseases, and systemic disruptions. Saturn 1. Governs structure, limitations, and chronic conditions. 2. Saturn in Aquarius suggests large-scale health measures, community-wide restrictions, and systemic challenges. Jupiter 1. Represents expansion and growth. When afflicted, it can signify the rapid spread of diseases. 2. Jupiter in Taurus, 12th house, D1, and Cancer, 8th house, D9, points to increased hospitalizations and transformative health challenges. Moon 1. Governs public sentiment and emotional stability. 2. Moon in Gemini highlights panic and rapid spread through communication or travel. Houses of health. 1. The 6th house, disease, 8th house, chronic illness, and 12th house, isolation and hospitals, are prominent in this analysis, indicating a health crisis with global ramifications. D9 chart analysis. Rahu in Virgo, 10th house. 1. Indicates systemic health issues, potentially of viral origin, spreading across public systems. Saturn Ketu in Pisces, 4th house. 1. Weakens immunity and suggests hidden or psychological impacts of disease. Jupiter in Cancer, 8th house. 1. Points to large-scale transformative events affecting public health, likely requiring global cooperation. Venus and Moon in Gemini, 7th house. 1. Suggests airborne or respiratory viruses spreading through communication or travel networks. D1 chart analysis. Rahu in Pisces, 10th house. 1. Signals global disruptions, potentially through public health systems. Saturn in Aquarius, 9th house. 1. Highlights restrictions and health measures impacting large populations. Jupiter in Taurus, 12th house. 1. Indicates hospitalizations, quarantines, and health-related economic challenges. Mars in Cancer, 2nd house. 1. Suggests weakened physical resistance, adding to vulnerability. Moon in Gemini, 1st house. 1. Reflects widespread emotional distress and rapid dissemination of health-related fears. Potential for a viral spread. High likelihood of global spread. The combination of Rahu-Ketu, afflicted Jupiter, and Saturn indicates conditions ripe for a global health crisis. Characteristics of the virus. 1. Likely airborne or respiratory in nature, Gemini influence. 2. Rapid spread driven by global interconnectedness and emotional instability, Moon in Gemini. Timeline of spread and control. Phase 1. Initial emergence, December 2024 to January 2025. 1. Drivers, Moon in Gemini and Rahu in Pisces. 2. Events, localized outbreaks and rising public awareness. 3. Control likelihood, low. Phase 2. Acceleration and spread, February to March 2025. 1. Drivers, Jupiter in Taurus and Rahu-Ketu axis. 2. Events, rapid global spread with peaks around mid-February and early March. 3. Control likelihood, moderate. Phase 3. Peak and stabilization, April to May 2025. 1. Drivers, Saturn in Aquarius and Jupiter in Cancer. 2. Events, peak infections followed by widespread health measures and early signs of stabilization. 3. Control likelihood, high. Phase 4, decline and control, June, August 2025. 1. Drivers, Jupiter in Cancer and Saturn in Aquarius. 2. Events, significant decline in infections, isolated cases managed effectively, and global recovery begins. 3. Control likelihood, very high. Countries involved most affected. 1. India, dense population and healthcare vulnerabilities. 2. US, high mobility and media-driven panic. 3. China, rapid industrial and global connectivity. Moderately affected. 1. Southeast Asia, Thailand, Indonesia, dense urban populations and tourism dependence. 2. Europe, Italy, Spain, trade and healthcare challenges. Less affected. 1. Australia, Nordic nations, geographical isolation and effective healthcare systems. Global impacts, economic disruptions. 1. Severe losses in travel, tourism, and retail sectors. 2. Healthcare, pharmaceuticals, and essential goods see heightened demand. Healthcare strain. 1. Densely populated countries face significant pressure. Global cooperation. 1. Nations collaborate on containment, vaccines, and healthcare resources. Conclusion. While the astrological alignments indicate a potential global health crisis, the presence of Saturn in Aquarius and Jupiter in Cancer suggests effective measures for containment and recovery. By August 2025, the situation is likely to stabilize, paving the way for global recovery and long-term prevention strategies.